Treatment of tonsillitis. Acute tonsillitis, if it is due to the virus, mostly it need not to be treated. It is cured on its own by proper bed rest, hydration, and good nutrition, and the preventive measures, that is use of mask, gloves, and sanitary steps, that is the washing of the hands before meal and after every washroom. So acute phase, if it is due to the bacterial infection, that is streptococci, pyogen, then it needs the use of and the administration of the antibiotic medicines. According to the severity of the disease, by oral or by systemic, that is IM or IV therapy. So antiviral medicines are rarely used in acute tonsillitis when there is prolongation of the recovery period. The disease is going to be more than 2 weeks. Then we can use antiviral medicine. But the antiviral medicine should be used within 48 hours of the appearance of the symptoms. They are mostly effective one. Their efficacy is decreased if 2 or 3 days are passed after the appearance of the symptoms. Symptomatic treatment: analgesics for pain, sore throat, dyspnea, dysphagia, the difficulty in swallowing and respiration due to the infection of the virus and the bacteria. Antibiotics are only used for streptococcal infection. Antiviral, they are only used in selective cases when the severity of the disease is exceedingly by the viral etiology. Then is antipyretics, because there is high grade fever. So antipyretics, especially paracetamol, acetaminophen, they are used one. Then antiviral disease, anti-allergic disease, they are also used as prophylactic steps. Whereas if there is cough symptoms, then antitussive syrups and expectorants, they can also be used one. Mostly the cases by the bacteria, streptococci, they are very drastic one and alarming one because they produce the complication, that is peritonsillar abscess, quinsy, cellulitis, lymphadenopathy of the neck, lymph nodes, that produces neck stiffness and pain, myalgia, arthralgia, carditis due to the exotoxin produced by these bacteria. There is splenomegaly, hepatomegaly. So these are the various indications. Cellulitis, indication of the chronic tonsillitis, and they lead to the process of surgery, that is tonsillectomy, that is to remove the tonsils altogether, because they become useless and harmful, and they have to be excised out of the body. As this is disease of the children and teens, so the health education is important by the parents to the children, that the trimming of the nails, then plenty of water should be taken, that is keep the patient hydrated. Excess amount of purified water should be taken. High biological protein like milk, egg, then coffee, soups, they should be used, and avoid the cold air exposure. Then minor walk, but the excess of exercise is avoided. Complete bed rest is a necessity. Then there is sun bath. Sun rays must be approaching to the body. so that they can produce, the required amount of vitamin D. This is the infection which is a contagious that passes from sick person to the healthy ones through droplet infection. Fomites, that is the articles used by the patient, they are contaminated by the secretions. I mean the I mean the mouth secretion, nasal secretions. So you should not touch the articles used by the patient by your hands. If you have touched, then you should wash your hands by soap water. Or if you are on the nursing duty, that you should use gloves and mask to save yourself. So patient should be used lozenges, and he should be avoid buke water, saline gargles to kill the or the slow down the growth of the virus and the bacteria in the tonsils. So these are the basic steps used for the treatment of the tonsil, medical treatment, and last of all, when there are indications for surgery, tonsillectomy should be performed, but it should be performed after the age of 5 years. Below 5 years, you should avoid. You should try, to treat the acute tonsil attacks and episode by the medical treatment. Health education is necessary, then vaccination against the influenza and the pneumonia annually is compulsory for every person, because these also check the appearance of the tonsillitis and the spread of the disease onwards.